Some patients will need to go to the breast imaging department before their operation. You will be advised if this is the case. Additional marking will be needed if you are having breast conservation surgery and it is either not possible or difficult to feel the lesion in your breast. The clip that was inserted into your breast at the time of your original biopsy cannot be seen or felt by the surgeon, so additional marking will need to take place to guide the surgeon. For many patients, this will be in the form of a radiofrequency seed which is inserted into your breast. For some patients, it will be in the form of a pen mark on your skin. The original clip that was inserted will help to show exactly where the further radiofrequency seed or skin mark needs to be placed. A radiofrequency seed will emit radiofrequency, which can be detected by a localizer probe in the operating theatre to show the surgeon where the cancer is. The seed will emit radiofrequency for many months after placement, so it can be inserted into your breast ahead of the date of your surgery. It can be inserted either with guidance from an ultrasound machine or a mammogram machine. Some patients will have an ultrasound performed before the surgery in order to guide the surgery. The person doing the ultrasound scan will look for the known lesion in your breast and the clip which was inserted into your breast when you had your biopsy. This clip will be seen on the ultrasound scan and will help us to find the lesion so that it can be marked for the surgeon. The lesion can be marked by inserting a radiofrequency seed. This is demonstrated on the video using a plastic model. In a real patient, the area will be numbed using local anaesthetic. Some patients will not need a radiofrequency seed to be inserted, but instead will have a mark applied to the skin using a marker pen. Some patients will have a mammogram performed to guide the surgery. The person doing the mammogram will look for the lesion or previously inserted clip. Some patients need to have a radiofrequency seed to be inserted into the area of the cancer to guide the surgeon to the correct part of the breast to remove. This will be inserted after the area has been numbed using local anaesthetic. Patients who are having a sentinel node biopsy will need to go to the nuclear medicine department on the morning of the surgery, or sometimes the day before. This is where you will have an injection containing a tiny dose of radioactive dye that will make some of the lymph nodes in your armpit radioactive. The amount of radioactivity is not harmful, and you do not need to avoid contact with other people or children. The surgeon will use a probe in the theatre to detect this radioactivity, and this will guide them when they are removing a sample of lymph nodes in theatre.